Hi, I'm Kris Wilhelm, and I'm a member here at Westminster. And during the pandemic, I had the opportunity to volunteer at the New York State Health Department in the COVID call center. I was in the particular call center that was calling people to tell them that they were positive for COVID-19. One of the interesting things was that I learned from this was the incredible strength people have under very adverse circumstances. There were people who you're giving them the instruction that they need to be in a room by themselves. And the first time somebody said, well, I can't really do that because there's 8 of us living in a room that was probably 12 by 12, you realized really the toll that this whole pandemic has taken on people. It's been a very we're asking people to do monumental things where, for other people, staying in a room by themselves and having their own bathroom was not an issue. There are other people that this was a real concern. The other thing was really dealing with people's anxieties. When you have the news on a daily basis showing the stories of people that are not surviving COVID, it was pretty dramatic to have somebody who's just fell apart the minute you said that test that you had done 4 days ago or 3 days ago, and sometimes it was 10 days ago, was positive, and really convincing them that they may survive this. They were just concerned that it was an automatic death sentence. A hard day was the day that I had 3 people with severe anxiety disorders, and they were very open about it. And we did have a mental health line that we were able to refer people to. And to hear them say at the end of it that the 20 or 30 minutes they spoke with me was like the best thing that they've had in weeks was, really, kind of got you right here, because you realize that you have incredible power to bring some peace to people. To really give them hope and to, help them tap into their inner strengths.
My name is Anita Opoku-Asante, and I work with people living with developmental disability. In short, it's OPWDD. And it's been hectic, as everybody knows. But for us who are able to go to work, it's been more hectic because regardless of um, quarantine, stay at home, we are not able to stay at home with our family. We have to go to work, and there has been mandation here and there because people are either falling sick or they are scared to come to work, and they are getting doctor's notes and things like that. But since the people I am dealing with are low functioning, let's say in the brain, we have to go there. We are their mouthpiece, so we have to help them. Somebody have to be there with them to guide, protect, direct, and redirect them on what to do daily. So it hasn't been easy, but since I love what I do, I still have to go to work. My faith has really been up high because I'm not too special than those who are dying. So my faith tells me that I'm being favored by God. And I think I'm being favored, or we are being favored, because of what we are doing. We are taking care of other people, and we love helping them. And I think God loves a cheerful giver, not only money wise, but with a clean heart, taking care of somebody who is vulnerable. I think it's the best way to also get your blessings from it. So God will not allow us to to go through that. Yes. So yes, my faith has been up high.
Uh, During the pandemic, it wasn't easy because you don't know who is getting and then who you are going to get it from. And I was so very anxious because I have a son who is asthmatic. So anytime I go to work, I make sure that I follow the uh, the rules that New York State Health Department has given, the guidelines. Some people don't show no symptoms. So this virus is so dangerous. So I'll be always praying to God, please don't let me go and meet somebody who have caught it. And then over there, they will take your temperature, but you may have it, your temperature will not show that you have the virus. So I was always praying. And then, as I told you earlier, that I always following the precaution.
So it's really hard looking at patients separated from their loved ones who have to die alone. They can't see their loved ones. They can't hold their loved ones. It's sometimes the question you ask is why God, why? But there's no answer. So I think things are getting better. We have less COVID patients now, and they're doing more testing, but people are, not really getting the virus. So people are following the standard of precaution and other things. So I think things will get better as time goes on. I remember when it started, like anytime I'm going, I would just pray in my car, say, God, just keep me through. I was scary. I remember one time I had a patient and we were going to rule the patient out for COVID. And we were all waiting for the result. That was the beginning. So, and I was the new nurse over there, so I had that patient. Because normally they will come and do the assignment and they give the worst one to the new nurse. So I had her and I was like scary. I prayed to God. I was just washing my hand. As soon as I get home, I would just strip everything outside the door before I go into the shower so that I don't bring the virus to my kids and my family. So I always pray to God to keep me through, and it's true, He kept us through. He's still keeping us through, so that's what I would say.
And then during the heat of the COVID period, I was on the front line, especially I was there to take care of the face masks, to distribute the face masks to every room, go to every COVID-19 floor and pick up the dirty masks that was in use and reprocess it and then send it back to the various rooms for all the doctors to use, because in the process of taking care of the COVID patients, there should be masks that the doctors will have to use or the nurses will have to use. So I was responsible with some other people to do the work. So for this reason, I was asked to be on the N95 team to see how best we can get those masks processed and give it to the doctors. I'm a believer. So before I leave my house every morning to go to work, I put my trust in God. I tell Him, because I work in the medical field where we deal with a lot of patients, and then going to work, I ask Him that everything I do is because of Him. So I ask for His protection and guidance on my job. So it was good for me. So I know how to fear Him because I know God was there with me. Yes.
Okay, my name is Olivia Quiah. I work for Center for Disability. When the COVID-19 started, they told us that they was going to close the center because I work at the day center, the day program, and then it was kind of heartbreaking for us, especially with the guys. We used to, working with the guys. And then my question was that if they close this place down, how these guys going to manage, who's going to help them? And they told us that they gave us the option. If you want to stay home, you can stay home after, the COVID-19, you can resume back to work. Or we can send you guys to the homes to go and help to work with the guys. So when they told us, and I thought about it, I said, no, I can sit home. These guys need help because they are disabled people. They need help. So I decided, I'm going to work. So they assigned me to one of the homes and we started going to work. It was kind of fearful. Fear came about. One way or the other, fear came about. But then I had my trust in God, and then I used to the guys. So I started going to work. And where they assigned me, luckily, I had 3, consumers that I know from the day program. So when they saw me, they were all, happy. Hey, Olivia is here. She's working with us. And that make me to get more energies to go to work in the house as God could have it. Nobody came down with the virus in the home I was working with. It was last minute when one of the co-workers came down with the virus. Yeah, one of the co-workers came down with it and they called the state to come. We all got tested and we all was negative. So we was like, woo! And I was dancing. I was like, yeah, my supervisor, my manager, we all started like kind of jumping, doing the joyful dance there. We all, everybody, even the guys, they were all negative besides us. So we were so grateful for that.
This COVID-19, only God will save us, because like me, every morning I pray to God. I lift myself to God. But when you sleep all night, you wake up, you have to say thanks be to God. And know that even food, when you eat the food, when you finish, you don't have to say it louder for everybody to hear, but deep down inside your heart, you say thank you. Yes, we wear masks, we wear gloves, all those. But who really can help us is God. So that's why I always said, COVID-19, we have to pray God hard for COVID-19. I would say that we should all take this um, COVID seriously. It's still out there. And we shouldn't say, oh, I'm going to visit a family member, this is a family member, so let's have a gathering without preventing or taking the precautions seriously. We should always wash our hands, keep our distance, and then pray also that God will give us a direction which way to go, so that we all stay safe and healthy. And I miss church so much, and I miss my Westminster congregation. Everything about the church we have been missed, but we are all praying that everything will go away, or God will guide us through. Thank you very much. Stay safe. Bye bye.